You've achieved a mastership in the Academy of General Dentistry. What is that all about?
That actually is a signifier that I have completed 1,100 credit hours outside of my dental school education, at least 500 of which have either been hands-on training within a seminar or that I've completed actual cases that I've presented to peer panel. I received that in 2009, and I will continue to accumulate continuing education credits, because after the mastership, every time that you achieve 500 more credit hours, you get a lifelong learning award through the Academy of General Dentistry. So it just never, like they said, that's why they named it the Lifelong Learning Award. That would be my next goal, to be able to achieve that as well. However, there's not that many people that have gotten to that level. There's less than 1% of practicing dentists have a mastership, and less than 5% of the actual membership of the Academy of General Dentistry actually have a mastership. Before the mastership was the fellowship. Before that is membership. The membership, even just a general membership in good standing for the Academy of General Dentistry, requires 3 times more education than Indiana requires for relicensure. Indiana requires 20 hours every 2 years. The Academy requires 75 hours every 3 years. So they require much more continuing education, and they're much more strict about which education you can take than what they do for licensure. So we have some very highly educated dentists in this office.
Been doing a lot of booking.
Lots of booking.
Okay.
I'm kind of a professional student, you could say.
Okay. But then also a lot of hands-on.
Yes, that's one of the advantages, especially since the mastership also requires you to take those credits over 14 different areas of dentistry. And you have to have a certain number of credits in each area. So it's not enough just to go out and do hands-on continuing education on, say, just general dentistry. You actually have to go in and learn every single area of dentistry. You have to go through oral surgery, through periodontal, through orthodontia, so that even if you're not actually performing all of those things within your practice, you become an extremely good diagnostician. So that means that I'm going to know when I can treat and when I can't, and when I need to call in the Marines, so to speak, and send you to a specialist, or as I think of it, as expanding the team. So we need to add a team member. If you need a periodontist for gum disease or for an implant placement, or if you need an oral surgeon for really difficult extraction, that's where you're going to get your best treatment, so that's where I would recommend that you go.